The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on anything you'd like to talk about your health, providing it's from a natural point of view. You know what that means? No drugs, no surgery. You've tried things, they don't work, so here's an opportunity. Let's see if we can figure it out together. Call me, 888-630-9625. That's 888-630-9625. Love to talk to you on anything that you have in your mind. Let's see what we can do about it and make a difference. You know, what do they say? Baby, it's cold outside. Be real careful out there, guys. Listen, the roads are starting to get clear, particularly the Beltway. How do I know? Because that's how I got to the studio today. But nevertheless, be very, very, very careful. There's a lot of slush and slip and so forth. The side roads are still pretty bad. We're supposed to get some more snow. And so when you go out there and you say, I can do this, and then you try to decide that you're going to, shovel, and you haven't done anything physical in how long? Not only are you risking back problems, and you get to see people like me, and you're going to hurt yourself, and you got sprains and so forth, but think about that heart and those lungs. If you haven't been pushing it, don't. And if you do it, take it a little bit at a time, one little bite at a time, and stack it up, and sit down. Go back inside. Don't do anything more than about 15 minutes at a shot without resting. You start feeling that heart bumping in your chest. It's time to slow down. If you're sweating too much, slow down. Get yourself inside and make sure that you rest in between shovels. The best thing is get some money, call somebody, tell them to do it for you if you haven't been doing this thing on an ongoing basis, because it can be ridiculously dangerous. We're going to talk about several things that I think you're going to find fascinating. One that just struck me probably about 15 minutes ago, and we're going to talk about that as well. What is that all about? Well, when we come back after the first part of the program, we're going to talk about why your dental floss could be causing you all kinds of problems, including potential cancers and thyroid problems and organic situations and so forth. You say, what? How can that happen? Well, we're going to talk about something called PFOA, and I'll pronounce that for you a little bit later. But I want you to know that it may not be the best thing for you. You got to go back to some old-fashioned things. But before we get into that, we're going to talk about our old friend, vitamin D. David, D. Well, here's the deal. There was an article that was actually released Friday the 11th of January. That was a couple days ago, right? And it came out in a Health Day News report. And there was a reporter by the name of Robert Predet that's published some information that was also then published U.S. News, and this came out from a couple different places, and they quoted the U.S. National Heart, Lung, and Blood Institute, and so forth and so on. So this is kind of real deal stuff, and what they said is simply this. Did you know that COPD, or chronic obstructive pulmonary disease, chronic bronchitis problems, emphysema problems, and so forth, nearly all of these diseases or these problems that affect your respiratory system are suddenly made far worse because of low levels of vitamin D. And in this area, in this latitude, about 80% of you are vitamin D deficient, and some of the reporting says much higher than that. But nevertheless, chronic obstructive pulmonary disease, includes a lot of different things that affect the lungs, but it can also be made much worse when you're not breathing properly, your lungs aren't working the way it's supposed to, then suddenly you get an upper respiratory infection, and now you got a problem, and far worse than you're not being able to breathe, because not only can you breathe, but this viral pattern knocks your immune system even further down than what it already is. So what we're seeing is all these things that we've been saying for how many years? Well, there was a study that took place and was 469 COPD patients, and they did 3 trials. And this took place in the United Kingdom and Belgium and Netherlands. Absolutely. It wouldn't happen here, right? So taking vitamin D supplements was associated with 45% reduction in lung problems among these patients who were deficient in vitamin D. But there was no reduction among patients with higher vitamin D levels. And what they noticed was across the board a correlation that either was or wasn't. So this study was released and published January 10th, last week, in the journal Thorax, Thorax, and that's a very renowned medical journal. So vitamin D supplementation is very safe and it's inexpensive. Head researcher, a guy by the name of Martineau, noticed that that this very highly cost-effective treatment could be targeted at those who have low vitamin D levels. Now, here's the twitch. In the medical arena, they're going to take you down to 30 as the low level on vitamin D, 32 some laboratories. So you have to begin to, do your homework. And the truth of it is that anything under 50 on the range of 30 to 100 is considered insufficient. 32 or less is highly deficient. And I can't tell you how many people, when we do blood studies in our office, come up with vitamin D levels definitely lower than 32. So the study went on to say about a fifth of chronic obstructive pulmonary disease patients in the United Kingdom, so about 240,000 people had low levels of this vitamin D. So worldwide, there's more than 170 million people with COPD, and the disease caused last about 3 years ago. I think that's when they did the original extrapolation, 2015, that 3.3 million people died because of the disease process. So the researchers pointed out that since the data in their study came from just 3 trials, the findings could be interpreted with a little bit of caution. But clinically, and this is what we want you to know, clinically, over all the years we've been in practice, we found that people who have adequate amounts of vitamin D above 50 generally have a tendency to stay immunologically stronger than other people who have not taken any vitamin D or their low levels are very, very low. So the U.S. National Heart, Lung, and Blood Institute has much more information on COPD, and I want you to kind of just start looking around. There's some really interesting data out there, and you need to know about it. Something as simple as taking some vitamin D, and not disulfiram, D2, and you need to take it if you're deficient on a day-to-day basis. And by the way, patients will often ask me, well, I've been taking vitamin D, but my levels are still low. What's that all about? There's a little organ system called your gallbladder. And if the gallbladder isn't working the way it's supposed to, or we're not getting the emulsifiers, the fat emulsifiers to bring certain nutrients into the body, and it's just not about breaking up fats that you're eating, then we see that those patients, not all of them, of course, but most have a much greater problem absorbing vitamin D. So then you have to go to, sunlight, which we don't have any around here right now, or you have to get in one of these, in front of these tanning lights so you can make sure that you're stimulating some vitamin D. But there's a lot of pieces of the puzzle that you have to be aware of. We've talked about it. If you put sunblock on, that stops or interrupts the vitamin D level. If you have soap on and you don't get it off your skin completely, that stops the vitamin D absorption. So what's the person do? Well, move to Florida, take all your clothes off, and don't wash with soap. Something like that. I don't know. 888-630-9624. That's 888-630-9625. Let's go to the phones. Ron, how can I help you?
But there's a lot of pieces of the puzzle that you have to be aware of. We've talked about it. If you put sunblock on, that stops
Ron, are you there? Hello? So we're getting a re-record of me talking to you, but we do have somebody online, and we'll get it figured out in a second. 888-630-9625. Give us a call, and we'll talk about, anything that you'd like to talk about. There's a conference coming up that I'm going to, and Sue's going to. We're both going to attend it sometime this spring. I think it's in April. And it's on integrative medicine, and it's one of the few times that They're not asking for my opinion, well, only because I have to go and get my continuing education credits, and this is a great outfit. So there was a pre-conference article that was recently published, and it was talking about two things: the challenges of functional medicine. What does that mean? What does functional medicine really mean? When you're dealing with functional capacities, it's the ability of the body to work in systems, not as a compartmentalized situation. Think about this for a second. When you go to your physician and you're complaining of whatever it is, and let's say that they come up with, and I'm making all this up, that they come up with, you have a heart problem, you have a heart valve, and a common one is mitral valve that has regurgitation. That's called a murmur, and it can be very significant, it can be very mild. What do they tell you about that? Well, they focus in on the valve, and they're going to say, well, we either have to watch it, and we don't want you to stress out too much, and at some point we may have to go in and we have to do surgery. We'll have to, at worst case scenario, replace the valve, or you may have a tachycardia. You can have an atrial fib, and they're going to go in and they're going to stimulate the heart to try to normalize its process. So at the bottom line is simply this: if all of that stuff is true, the question that is not being asked is, why is that? Why did it occur in the first place? Where is it coming from? And if you don't answer that question, you can't help people. So functional medicine opposed to traditional doc-in-the-box medicine, or, you go in and you see your normal guy. It's not that they're bad people at all, not at any level whatsoever. It's just that they're taught to think in compartments instead of systems. Functional medicine protocols, and even according to the Institute of Functional Medicine, if you don't look at the body systemically, what's causing the problem? For example, so let's take that, let's take the heart. It's just kind of a fun organ system to look at, right? It has to have many different inputs. It has nerves, and there's 3 electrical sources, actually. There's the pacemaker within the heart, there's the vagus nerve that comes from the brain, and then there's nerves that come from the spine. If any of those nerves are malfunctioning or not working the way they're supposed to, the heart can't work. It's like you're not plugging the juice in, or it's getting too much or too little. Not going to work the way it's supposed to. So how do you find that out? You got to look at people like me. And, we take a look at it, and we look at it multidimensionally. You have to look at the energetic platform, how the body receives its energy to that system. Well, in a traditional sense, we're going to look at something called coenzyme Q10, CoQ10. What does that have to do with anything? Well, what that has to do with it feeds the little engines within the heart that are called mitochondria. And the highest concentrations are within the brain and the heart. So if you're taking certain medications that deplete coenzyme Q10, it would be really good to be able to take stuff to set aside the potential side effect of taking those medications. Aspirin's one of them. Statin is another one. And you have to make sure that you're balancing the nutritional weaknesses that are caused from some of the stuff with the other. So thinking in systems, remember that, thinking in systems. What are all the inputs? We look at potassium, we look at magnesium, we look at the balance of sodium, salt within the body. All these things are important. We look at calcium channel blockers, stopping the calcium from getting into things. That needs to be there in a balance with magnesium. We're going to talk more about systems, healthcare, functional medicine when we come back. We do have some people on the line we will get back to. 888-630-9625. That's 888-630-9625. Don't go away. You're listening to Dr. Tom Roselle live in this very interesting Washington winter day. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live. I'm in studio. Call me. 888-630-9625. That's 888-630-9625. Yep, we made it through the highways and the byways, and actually the main roads are actually pretty decent, pretty clear, particularly in the Virginia side of the Beltway. A little different up in Maryland neighborhood, but still pretty wide open. Neighborhoods not so good, so really be careful. And I said earlier in the program, please, 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 please don't get out there and start shoveling where you haven't done anything, even gone for a long walk, but you think that you got to clear your sidewalk or your driveway. If you're going to do it, small bites and only for about 15 minutes at a time, and stop and relax a little bit. And if you end up with chest pressure, arm pain, you get yourself to somebody very quickly. Don't be foolish, okay? This is one of the things that can take people out, and, we want to avoid anybody leaving us on a permanent basis. Let's try the phones again. Ronald, how can we help you? Are you still there?
Yes, I'm here.
Thank you, my friend.
Can you hear me?
Yep, I sure can. I can hear you. What's going on? How can I help you?
I've had some groin problems for the last couple of years. I had an X-ray done, and the bone structure looked good, but then they did an MRI and came up with a diagnosis of osteonecrosis of the hip, the ball joint of the femur. Can you help me out in terms of alternative approaches to surgery there?
Sure. There's first you got to find out what's causing. Let me ask you your age. How old are you?
72.
Okay. You have a very strong voice for 72. That's extraordinary. Excellent.
Oh, I'm in excellent shape. I mean, I've been working out for 50 years. I do meditation. I do all kinds of things. So this came as quite a shock to me.
So a lot of things can come about and cause that type of situation. It can be injury. It can be long-term over, activity where the ball and socket, the femur, and it's called the acetabulum, are not sitting properly, so there's a lot of rubbing, there's a lot of torquing. But a true osteonecrosis, where there's actually deterioration, breakdown, that it can lead to tiny breaks within the bone itself, and then pretty soon the bone eventually collapses. The bone can dislocate at that point. It interrupts the blood flow. Avascular necrosis is associated with a long-term if you will, use of certain types of medications, and I'm going to assume that you haven't been on any things like steroids.
No medication at all. No medication at all.
Okay, so we rule that out. So it has to be an injury pattern, either by position or actually impact, that over a period of time has begun to break down. So the two things have to be done. One,
yes.
So depending on how bad the hip is. Now you can repeat the program, by the way, and you can check this out and listen to it all over again. But what has to be done is, one, you have to see how much damage there actually is. Is it in the fossa, the acetabular area, or is it in the femur head itself as it attaches, or is it both?
Femur head, femur head.
Okay, so the thing of it is that you look at that now, acupuncture, low energy, light laser, and then positioning of the pelvis, getting it to realign itself will stop the process with certain nutrient bases and so forth. So you have to look at all of those things. Particularly as it relates, to the positioning of that femur head. Now, depending on how far it's gone, that'll slow it down, that'll stop it from progressing very rapidly. But you also have to, consider at some point, is surgery necessary? You're going to have a total hip. In today's world, stem cell can be very, very effective. And we're talking about amniotic stem cell and certain other procedures that, if they're done specifically, if you are a candidate, can't tell you without looking at your films, then you can see very interesting regeneration. The information is quite significant, but it's individualistic. You have to take it one step at a time. First, find out what the position of the hip is. Two, find out how it's actually affected the blood supply, to the joint space, to the tissue around it. See what can be done to stabilize the energetic and the muscle balance within there. And then the last piece is, if you are a candidate, then stem cell. And stem cell usually is applied once into the hip, and it takes usually about 4 months for it to begin to optimize itself. It's about, based on the literature that's out there, if you're using amniotic stem cell, if you are a candidate, again, I'm going to put that codicil in there, it's about 85% effective, where you're going to actually get function back and, you stop the progression of that. So, if I can help you, make the decision or evaluate it, all you have to do is, send us a note or give us a call, and we'll be happy to look through that. But, you have to look at osteonecrosis, avascular necrosis. You have to separate them based on what they are. You have to look at what's your lifestyle. You've been an athlete. You've been doing some good things for yourself for a lot of years. But that doesn't rule in or out the nutritional patterns that may or may not be balanced properly for you. All of that has to be, check to see if that's there. But does that help you, Ron?
Would you request the MRI and the X-ray on film and bring it in if I did come in?
Yes. I want to see both of them. So if you do that, give us a call. I want to see both of them, and I appreciate that. I hope I gave you a little bit of information to consider. There's a good shot that you can be helped, but only a full evaluation would actually determine that. We're coming up to the break at the halfway point of the program. You'll give us a call at 888-630-9625. It's cold outside, so be careful. Don't go away. I'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I did make it across the highways and the byways with the snow, but I want you to be very careful. If you don't have to go anyplace today, stay home. It's not worth it. Let them finish up getting the roads cleaned out so we all can go to work tomorrow morning. Give me a call, 888-630-9625. That's 888-630-9625. It was funny. As I was walking in the studio, my engineer, Jeff, said, "Did you get my text?" And I said, "What text?" I hadn't looked at my cell phone yet. And he said, "I sent you a text to see if you're going to make it into the office." And then he wrote a note that said, "Well, you grew up in Western New York State, so you'll probably be here." And the truth of it is, yes, I did. I made it in, no problem whatsoever. Let's go to the phones. Dave, how can I help you?
Yeah, well, now that I've gotten some age on me, I'm having a lot of trouble having to go to the bathroom all the time, and it's just wondered if there's anything that can be done by that.
There's a lot of different things. See, what happens, I'm going to take it from an Eastern perspective, and I'm going to take you to a Western perspective. So the urinary bladder is the thing that gets stimulated, so you have to go to the bathroom. And it controls, in Chinese medicine, the acupuncture channel called kidney is your primary source of energy in your body. And so that feeds all the things, but particularly that organ system will begin to show deficits, if you will, if that isn't as strong as it should be. So here's the deal. If you start noticing that you're having to get up in the middle of the night, you have to get to the bathroom, it's usually because the energy platform has been depleted. Now, that happens for a lot of reasons. And first thing that we're going to look at is something very, very easy and simple. If you have an enlargement of the prostate, benign hypertrophy of the prostate, as we get older, what we see is a beginning deficiency in zinc. And the dry weight of the prostate is 50% zinc. So as the zinc levels go down, we see prostate problems become much more significant, and you don't void completely, the bladder gets bigger, and you're constantly being triggered to go to the bathroom. That's one of the things that takes place. Another thing that can take place is simply the energetic imbalances throughout the system. So, we look at patients, and unfortunately, some people start this silliness of having to get up at nighttime, early on, meaning in their 40s, which is really way, way, way too young, saying that the body's becoming broken. But you have to look at all the structural, chemical, emotional pieces that are associated with any condition. In this particular situation, you always want to look at the nerves that go to the spine, or to the bladder. You want to look at the biochemistry, things that you eat that you shouldn't be eating, and they accumulate over time. They become more irritated. They're more inflamed. You take those things out, and just doing that often changes everything. And I'm just going to give you a mantra: sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products. We have more problems in this country than other parts of the world. And it's because of the things that we eat. We eat way too many refined meats, and meats generally. And so subsequently our acid levels, our pH levels become much more distorted, where they should be alkaline and not acidic. So that's another piece of the puzzle. So what you're going to look at in somebody like you is, I'm going to look at your dietary patterns. I'm going to look at your acupuncture energetics. I'm going to look at, your structure system, but I'm also going to look at your dietary patterns to fix it. Now, there are a lot of nutrients that may be useful, and everything from sal palmetto to zinc, and we can go on. There's many different types, but again, they have to be individualistic. But what we find in this country is this lifestyle that's causing the problem. People don't sleep the way they're supposed to. They get all jacked up. It starts debilitating. The organ system that is also involved in the silliness is called the adrenal glands, the fight-flight glands. They sit on top of your kidneys, and they put all kinds of steroids out, and they help regulate and balance many of these platforms by stimulating other systems as well. So that's where you start. and without knowing more about you, your vitamin D level, by the way, we talked about it earlier. If your vitamin D level is very low, you will have an increased tendency towards what we're talking about right now. So you have to take a look at that as well. You have to look at the lower perineum, the muscles that are supportive of the lower part of your pelvis. As you know, when you push to go to the bathroom, if those muscles don't respond quickly and come back up, you're going to have other problems. It's going to pull down on those organ systems. You could have back pain. You could have leg pain. Again, it's not a simple take this and see if it works. How old are you?
75.
All right. So, you probably could take some low dosage of zinc. Probably not more than about 30 milligrams a day to start with. I don't know what the rest of your health index is like, but that can make a difference. But the other pieces are important. Acupuncture and looking at your dietary considerations and so forth can make a huge difference. Then you got to look at your medications, because there are medications as well, if you're taking any, that can also cause that as a side effect. Dave, if we can help you, give us a call. More than happy to walk through it and make that determination. A little bit of individualistic, but my guess is that we've probably hit a few of the checkbox when it comes to, that type of situation. Rick, how can I help you? Thank you for calling.
Yes, hi, doctor. I'm a 53-year-old male and been using Rogaine, and I've heard you talk about some what the deficiency is and what can be taken for hair loss, if I recall correctly, and I don't recall specifically what it was.
Well, there's not just one thing again, Rick. It's, there's many things that occur. You have to look at, first your genetic background. Hair loss genetically is always on the female side of the family, and it may not be directly at your mother's father, but it may go back to your mother's mother and people on that side of the family. I'll give you an example, all right, and then we'll talk about a couple of things. If you've seen a picture of me, you know that I don't have any hair on the top of my head. And my mother and my mother's father and my dad and everybody on that side of the family, they had a ton of hair all the way to the time that they weren't here. So I look at it and say, where did that come from? What happened? And it wasn't until about 5 years ago, I was going through Facebook, and I came across a cousin who was his mother was my grandmother's first cousin, and on the female side of the track. And guess what? He looks exactly like I do. And I'm saying, there it is. So you're not going to fix me, not without going in and doing some stem cell injections in the head and so forth. And that's too painful. I'm not going to do that. And, my kids wouldn't know me, and it's like changing my name. Not going to happen. But nevertheless, if there's other pieces that are involved, it can be nutritional deficiencies. It can be biotin. It can be zinc. Combination of those things, that can be useful as well. If you've been using Rogaine, the problem with Rogaine is there's a lot of side effects. I would encourage you just to go online and say side effects of Rogaine and check it out. Not one of the healthier things that you can be doing for your system. Then you end up with other problems with libido and testosterone levels and so forth. Now, having said that, there's one element that can cause hair loss if it's very low, and it comes as a result of stress in the body, and it's called DHEA. And if the DHEA levels, which I call it the mother of all hormones, are not there, then your bad testosterone, your DHT, is going to be too elevated, and subsequently you're going to get the type of hair loss where hair breaks. The follicle is being irritated, and subsequently, regardless of what you use, it's not going to make a difference. So you have to learn, you have to know about other things, really look into your genetic background, see if it's there. There are things in today's world that can be done. I briefly talked about stem cell. It's expensive, for those who are doing it. I don't know anybody in this area that is doing that type of work. But still, when you do that, people ask me the question when it comes to any kind of genetic intervention. We'll call it that way, okay? Is it permanent? Well, it's only as permanent as what your lifestyle is. If you mess up again, you keep doing the same things over and over and over again, you're going to get the same outcome again. And so, yeah, it'll work for a while, but if you go back into that same loop without changing other things, as a patient came in the other day and asked me, well, should I do hip injection for my degenerative hip? And I said, if I was in your position and if it was me, I would probably do that. And they said, well, is it going to last? I said, well, here's your option. Do you want an artificial ball and joint in that once you cut, you cut? There's going to be certain things that you have to deal with. No surgical intervention when it comes to joint space replacement is ever the same. Or do you want to change your lifestyle, stabilize this thing, get it squared away, and then do something that may last a whole lot longer than you are on this planet? So those are the considerations, and it has to be individualistic. So, Rick, what I would say to you is this. First, I'd have to know a whole lot more about what's really triggering your hair loss. There are things that you can try, like biotin, which is well known, and add some zing to it. Look at, your lifestyle and see if your system is stressed out. If it is, the adrenal system has to be supported. Functional medicine, testing DHEA. What that means is that instead of a blood draw, you want to have a saliva level. Saliva is actually what's getting into the tissue, whether it's testosterone, whether it's DHEA or thyroid or anything else. That gives you what's actually getting there. So you have three types of testing. One is that you have this big pool of stuff. That's what if you do a blood test, that's what they show you. Second, they have another element called free something. It could be free T3 for the thyroid. It can be free testosterone. It can be free estrogens and so forth. These are the ones that can be available to transport. Then you want to know what's actually getting transported in, and that's your saliva. So once you know that, even if you have a whole lot of this other stuff, if you don't know that other piece, you really can't tell. And then if it's not getting in, the next question becomes why? Why isn't it getting in? And then you treat that. So there's things can be done. If you want any of our guidance, what I would do is make an appointment in our nutrition department and have them take a look at you and, take any blood work that you may have, bring it with you. Any hormone testing that you have, bring it with you, and they can guide you accordingly. Does that make sense to you, Rick?
Yeah, appreciate it, and I will do that. Contact your office. I'm in Maryland. But one other quick question, if I may. I'm fairly active in terms of working out and my occupation. But as far as doing sit-ups, I read recently that the U.S. military did away with sit-ups because of the stress or what it causes on the back.
Sure.
Is that what your advice would be as well?
Well, here's the deal. When you do one set of muscles, you have to do another set of muscles. Okay, so if you do your stomach muscles, you got to do your back, your butt, and your thighs. Those are the compensatory muscles. So, and when we do sit-ups, if you're doing them straight leg sit-ups, your first 30 degrees, you're going to engage a muscle called the psoas muscle, and that's going to pull on your back. If you're going to do sit-ups, there's a lot of different ways to train that core without doing the traditional sit-up, but they can be part of a normal functional exercise program, but you have to make sure you balance that. So let's say that you do sit-ups with your legs bent, but your elbows should be way out, by the way. So you're only pulling on your stomach muscles, but then you need to do things like lunges, or today they're called burpees, and you need to do back extensions, and you need to do rotary exercises. You can do them with a heavy ball, just sit and, rotary twist as you're sitting down. You want to engage and strengthen the core first before you do anything else. Okay? So that can be very, very useful. Core first. One of the best exercises that you can do is planks. Your goal should be to be able to hold a plank perfectly for anywhere from 2+ minutes. So if you start trembling and shaking and your body collapses, you start working on that first. When we start rehabilitating our patients with any kind of structural problems that they have, after we done treating them, structurally and with manipulation and acupuncture and so forth, before we say, well, give me some exercises to do. I'm not just going to give them stretching exercises. I'm going to give them something that's going to be engaging for the core so they can begin to strengthen the small, intricate muscles around the spinal column and make sure that we have power there before we do anything else. So if we can help you in any way, please give us a call. Happy to point you in the right direction. Susan, you have been very, very patient. How can I help you?
Thank you. Hello?
Susan, I'm here. I can hear you.
Oh, okay. Yeah, I had a question about COPD and the best vitamin to take for it, or perhaps exercise also.
there's not one vitamin for COPD. If you listen to the beginning of the program, we were talking about the studies that they've been doing with vitamin D, and I said that people who are vitamin D deficient will have a much greater problem with COPD, and that's according to the research that was just put out a week ago. So if first of all, you find out what your vitamin D level is, and based on that, then you supplement accordingly. It has to be a natural form, and there are many different forms, and you don't want to do D2, which is disulfiram, and you want to continue to take it. But there are things, it depends on where it's coming from.
How much? How many milligrams?
Again, it depends on what your vitamin D level is. You probably, if your vitamin D level is very, very low, meaning 30 or less, you could be, you could safely take 5,000 units, but I'm not going to tell you to take anything more than that because I don't know you. But that's where you start. But you got to get the vitamin D level done so you know what it is that you're treating. You start there. There are many other things, and there are exercises that you can do to increase the vital capacity of the lung. But you're also, again, you want to look at this multidimensionally. You want to look at the energetic platform, the acupuncture energy. You want to look at the nerves that go to the lung. The vagus nerve from the brain also goes to the lung. Nerves from the spine also go to the lung. You have to make sure that the diaphragm is working so you can expand lower and optimize, the air sacs within your lung. All those things are critical, are important in making a decision. But I would first start with getting a vitamin D test. There's many other nutrients, but that's where I would begin with you if you were my patient. We're coming up to a break. We've been talking about a lot of different things today. It's a good program. Don't go away. You're listening to Dr. Tom Roselle Live.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, as you do every Sunday at high noon on the Eastern Seaboard. Thank you for those who are listening all over the country. Appreciate everything that you do to let everybody know where they can get the best information on integrative natural health care right here every Sunday on Dr. Tom Roselle Live. I promised you at the beginning of the program we were going to talk about something that you need to know about. And I said what you may be flossing your teeth with could be hurting you dramatically, causing cancers and thyroid problems, right? Well, what we're talking about is something called perfluorooctanoic acid, or simply PFOA. And what is that? It's you'll be real surprised when I tell you what it is. It's the slip and slide on your skillets. Right? It's the thing that makes nothing stick. So I have to tell you something, right? The studies have been coming out like gangbusters, and they're talking about not only is it dangerous to the localized tissue, but it also is dangerous to your overall health. And it can potentially cause thyroid problems. It can cause certain types of cancers. It can cause respiratory, heart, disease, dementia, and the list goes on and on and on. So you have to look for, on the side label, words that contain quote-unquote fluoro or perfluoro. That would tell you that you have a PFOA covering on this. And I would encourage you to go back to the old-fashioned way of cleaning your teeth and, get those old string pieces out. It's not okay. There's more and more things that are being put out for, on the initial surface of things that can help you, but nevertheless, it makes it much worse in the long run. Scientists have found that more than 10% of the people exposed to drinking water, in addition, have PFOA contaminants. And so if we take it to another level, so now you're adding direct and indirect exposures, and these things are going to cause thyroid problems. We know straight across the board. You can ask anybody that deals with thyroid problems, whether it's a Hashimoto's thyroiditis or just a simple hypothyroidism, or even a hyperthyroid, a Graves pattern, which is an autoimmune condition, that we're seeing more and more of them than we ever have before. So, but be very careful with this non-stick chemical that they're putting on the strings of your dental floss, and it's simply, these PFOAs, and it's really a small part of a group of non-stick chemicals, generally called PFCs, and they have unique properties in that they make things less resistant to sticking and stains, and that's how they're marketing this stuff. And everybody says, "Oh, wow, that's going to help me keep my teeth clean," or it's going to, it's easy to get in between my teeth. It just doesn't stick as much anymore. Well, buyer beware. Be very, very careful that, you're putting things in your body that can be much more profoundly problematic, if you will, than just the inconvenience of having to pull a little harder. And by the way, if you use dental floss and your teeth bleed, start taking some vitamin C. It's generally telling you your ascorbate level is probably pretty low. And you could easily take 1,000 milligrams a couple times a day without any trouble whatsoever. Vitamin C is water soluble, so what you don't use will be urinated out. And by the way, don't take 1,000 milligrams or 2,000 milligrams all at one time. It's always best to take a little bit now, a little bit later, because your kidney has a filtration rate of 1.66 milligrams per minute of vitamin C that's floating through it. So don't throw it in there all at one time. So your body can use what it has, and then you can, get rid of this stuff. But easily bleeding gums is often a vitamin C problem. So make sure you get that done. It was a fun program. Thank you for your calls. I really appreciate it because it allows me to help you and open your eyes to a different point of view. And just remember, as always, any type of information you hear, check it out, whether I'm telling you or somebody else is.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.